Good evening, all. I hope my new laptop is good enough. Welcome back. So yesterday we discussed the emotional and intellectual aspects of the and spiritual aspects of the fire. Today we'll discuss how physically we can use it. Today we are discussing about heart meridian. So totally it has 9 points. So again, out of 9 points, we use the 5 elements points which we require. So if you take that, wind point is your H9, heat point H8, and humidity and event source point is your H7. And we use H6, the dryness point, and coolness point is H3. Again, it is a in meridian. So totally out of 9, we use 5 points. Of course, in that 9, we use 1 or 2 based on the requirement. Let's see how can we use those points effectively. The first most important thing, for all the disorders, we can use heart meridian points. According to me, with my clinical experience, heart meridian points are very rarely used. Heart and kidney, it's the very deepest organ. Most of the times, they won't affect in the initial stages of the disease. In initial stages of disease, it won't affect. The long-term effect on the liver, maybe more than a decade, it affects the heart. The long-term depletion of spleen and stomach, it affects the kidney. You might have seen the patients who are all diabetic more than 15-20 years. For them only, kidney issues happens. And we're all having fatty liver and cholesterol issues, long-term liver disorder or liver functioning weakness that leads to the heart blockages and all. So here, maybe 8 out of 10, even though people are having heart disorders, you can solve by treating liver. Because the most of the illness to the heart, it's because of the bad source is the liver. What we say, cholesterol, from where the cholesterol, it goes to the heart. It's the liver only doing the fat metabolism. No? Again, if heart ejection factor is low or heart rate is low, so who is responsible for it? It's the liver only. Nobody else. Liver, which is responsible for the wind and momentum in the heart. The heartbeat, even if anybody says the heartbeat is 110, 120, excess of heart rate and heart palpitation. Who is giving the momentum to heart to palpitate more? Anybody else than liver? Because liver is the source of wind. So, heart points can be used in 3 ways, as I told in the last class. 1, as an organ. 2, as a meridian. 3, as a energy. All 3 aspects of heart and how best we can treat. If you take energy perspective of the heart, through this, you can treat the fire, that in fire. The yang fire is small intestine. So you can use to treat the fire, and It is used to treat the upper warmer. Heart and lungs are commanding organs of the upper warmer. Any problem which comes above diaphragm, it's a heart. It may be chest pain and shoulder pains, neck, mind, emotions. So all the upper warmer, even the excess of heat, all you can treat with upper warmer. So here the source point in this is heat point. This is the source point, and H7 is the sun, and grandmother point is H3. So what is H9? It's a mother point. Now, if you take how best we can treat heart meridian through these points. The first, if you see the physiological way, heart meridian starts here, R2, R3 goes like this, and it will end here. This is the point, H9. This is your H8. This is your H7, H6, H5. Then this is your H3. Then H1 and H2. So because which is covering the hand and the shoulder, if you can treat this overall having the pain or numbness across the heart meridian. Look at this. If you want to treat the issues along the heart meridian, you can treat your H9 point because it is giving the wind, the momentum to the heart. This can be used to improve the muscular energy along the pathway of heart. What is along the pathway of heart? Here, if you have any numbness, pain, tingling sensation, or heaviness of the chest in the left hand side, in all those time, either you can just twist H9 or you can tonify by using the pepper. But we rarely use H9. Why, you know? The point of what H9 will do, you can do better than that with liver 2 point. Then why you need to H9? H9 we are using to raise the yang energy across the meridian. So, you know that last year, October, one of the famous Kannada actor died due to heart attack, Puneet Rajkumar. So after that, many people, they are visiting our clinic, saying that I have chest pain here and across this. And they're telling, we went to all best cardiologist and they are bringing this much of reports. Doctor telling, you are fine. But for myself, I'm feeling heaviness, pain here, and breathlessness, numbness, all the symptoms they are telling. But doctor telling you are normal. Then to whom you need to believe? Patient is right or doctor is right? Many times it happens, no? The patient is suffering, doctor taking all the reports and scan and telling you are normal. And sometimes, especially in diabetes, patient is telling up, I'm fine, no tiredness, no hunger, I'm fine. Doctor telling your diabetes is more. The patient is telling I'm fine. So these things happens because this pain numbness which is happening, definitely it is a heart yang deficiency. But that is there in energy level. It is not converted into physical level so that it can shown in the ECG, EEG and treadmill test. Then what to do? It's very simple. You can raise your art yang energy with the liver to sedation. You can raise art with liver to sedation. If anybody complains the pain, tingling sensation, numbness and heaviness and chest pain along the art meridian, definitely they have issues of the art. But that art issue is there in the energy level. When they will get symptom energy level into physical level, maybe after 1 year, 2 years, 3 years. Solving that time, it takes a lot of time. But if you solve now, it's better, no? Frozen shoulder is different. It's here, unable to lift. I'm telling the inside of your biceps, this area. This area, are you listening? Checking this? This is the area people getting pain. This is the art meridian. So, if all these symptoms are there, then it is a art yang deficiency. Most of the times it happens left hand side, sometimes right also. Why it happens in the left side means art is a in meridian. It's not like that art is there in the left side. It's because art is a in meridian. I told previously only what happens in the left side, it's in, and right side is a yang. So immediately, if anybody feeling all these sentences, this one, you can press, this is the H9 point. You can press that point and you can twist that point. They feel better. Okay. For permanent solution, you have to raise the art yang energy. How you can do? Just to do liver to sedation. That will raise liver yang and that also raises the art yang. If you want to do it right now, immediately, then you can go with H9. My suggestion is always better to treat art with the liver. That will give you the permanent solution.